A trip to the doctor just to get a script for your regular medication can take a lot out of your day, but now you can order prescriptions online, bypassing your GP altogether.
Convenience, safety and accessibility are the three biggest priorities.
A doctor in the palm of your hand. It's as simple as click and collect for your regular medications with a few checks and balances in place.
Visiting your GP will always be the gold standard in terms of safety.
But if you're in a bind and need your medication fast, you can now go online. That means there's no waiting time to see a GP.
We use our phones a lot, so an app will be really, really helpful.
We've got that additional safety step of the medication being dispensed at the pharmacy.
Dr. Asher Freilich is the Clinical Director of Instant Scripts. The app is just one of several online platforms offering the service.
So we're confident that performing digital medicine this way is the safest protocol.
So how does it work? Online prescriptions are all about convenience. On the app, you select the drug you want. Then you're prompted to answer a few quick questions like, have you had this medication before, or are you allergic to anything? Press submit and the results are sent to a GP to review. Within minutes, if your prescription application is successful, it will be emailed to a pharmacy, and that's where you can simply go and pick them up.
Well, it's tremendously convenient and safe. We're not there to replace the patient's GP.
It is all about accessibility and the wait time being 4 to 6 weeks at the moment, and a lot of GPs are not even taking on new patients.
For regional towns across the country, the technology is providing a much-needed medical lifeline. In local pharmacies, instant script portals are being installed.
You have the opportunity to still talk to a professional and get your scripts nice and quickly and easily.
Everything going there with the terminal.
Showan Kashani is the local pharmacist at Millawa in regional Victoria.
We do check to make sure, if I obviously don't know the patient, whether they've had that particular medication before, either by contacting their regular GP or the pharmacy that they normally go to.
Instant Scripts offers over 300 medications to treat common conditions. Drugs for asthma, cholesterol, depression and anxiety, diabetes, pain relief and the contraceptive pill are all available online. The online services are not designed to be used regularly, and Dr. Freilich says around 97% of users are for repeat prescriptions.
The danger is not in taking the medication, there is much greater danger in stopping the medication if you're on it regularly.
If patients are going to go online, then your usual doctor won't know what you're on and what you've been taking.
Dr. Harry Nespolen is the president of the Royal Australian College of General Practitioners. He warns using online prescription services may lead to some patients being misdiagnosed.
It's hard enough to do it when you've got people's backgrounds. It's almost impossible to do when you don't know anything about the patient at all.
He says regular checkups with your GP are also a chance to change your medication.
They're trying to get patients on the lowest number of medications that the patient needs to be on.
I'd want to go and talk to the doctor who knows me.
The more you can stick to one GP, the better your outcomes.
If there's any case for technology to get involved, it's healthcare.
Those online services charge $15 to $77 per script. Again, always speak with your GP before starting or changing any treatment.